Welcome back to the OHSU Effect Inside Health and Science. I'm Lacey Evans, and we're talking about allergies, and we want to talk more about pet and food allergies now with Dr. Anthony Montanaro, the Chief of Allergy and Immunology at OHSU. So we left off talking about kind of pollen and hay fever and all that, but I wanted to talk about food allergies. How common are they?
Well, food allergies are very common, and as we talked about earlier, they primarily affect young children. And unfortunately, we have experienced what many people feel is an epidemic of food allergy in children. We used to quote about 5% of children have food allergies, but more recent surveys have indicated that many more children suffer from food allergy, and we're seeing more and more serious food allergy. We call that anaphylaxis, where it's a potentially life-threatening condition.
Is it more common nowadays?
Absolutely. I mean, we're seeing more food allergy, more peanut allergy, more deaths from anaphylaxis. So it's a very serious problem, and it's one that's on the rise. Yeah,
is there any research showing why it is more common now?
Well, it's probably because we're seeing more expression of allergic disease overall. And we see more hay fever, we see more asthma, we see more hives, we see more drug allergy. So we're experiencing a shift in the way we express allergies in our population. A lot of people feel that it's due to the so-called hygiene hypothesis, and that hypothesis basically states that more infection begets less allergy, and as we use more antibiotics and are exposed to less infection, children have more allergy.
What should a person do when they're having an allergic reaction that they weren't expecting?
So, obviously it depends on the seriousness of how that, what the reaction is. If they are having just mild reaction, if they have just a little bit of itchiness of the lips or of the tongue, certainly you want to no longer ingest that particular food or medication. You should, so avoidance would be number one. Number two would be to take an antihistamine. And actually, as opposed to the over-the-counter antihistamines that we use for hay fever type things like the Zyrtex and the Claritin equivalents that you can get over the counter, Benadryl has a much more rapid onset of action. So we recommend Benadryl as the first step. If there is any suggestion that that you may have difficulty speaking or swallowing or having shortness of breath or having lightheadedness, anything that suggests more serious nature, they need to call 911. Most of our patients who have previously had severe allergic reactions carry epinephrine, and epinephrine, it comes in a self-injectable form, can be life-saving if necessary.
Yeah, and food allergies can be very serious. I mean, peanuts, for example, even if a spoon has been used to, spoon peanut butter, and they can't use that spoon, even if it's been wiped off,
So there are patients who are exquisitely sensitive, and even mild exposure. There was the famous case last year of a young college student who unfortunately died after being kissed by someone who had eaten peanut butter. Those are very unusual, but there are patients who are extremely sensitive.
Let's talk about pet allergies. Is it possible to have pets and allergies at the same time?
The answer is yes, that some people can live with their allergens and allergies. In fact, there's very interesting data suggesting that if you have a child, an infant who's born who is at high risk of developing allergies, that is, they have allergic parents, that if they're raised in a home that has cats, they're less likely to develop sensitivity. So they become tolerant, and they're less likely to develop hay fever and less likely to develop asthma. The problem is that once you become sensitized, that is, once a child or an adult starts having itchy eyes and cough or shortness of breath from a cat, there's no, you can't develop natural tolerance from that. So you really should get rid of the cat in that situation. Dogs tend to be less allergenic than cats, and you should, your listeners should be aware that there really are no non-allergenic dogs or non-allergenic cats.
Well, I was going to ask you about that because we kind of heard about hypoallergenic dogs when the Obamas were moving into the White House
Right.
and he was trying to find a pet for
Right.
his daughters.
So obviously, and even that, the Obama dog has dog allergen. If you get a pet that doesn't shed, and if you get a smaller pet, you obviously have less allergen. If you get a big golden retriever, that weighs 75 or 100 pounds, they're going to be a dog allergen producing machine. But if you have a little 10-pound, miniature poodle, they don't shed, and they obviously are capable of producing less allergen because they're smaller. But there are no non-allergenic dogs.
Are there certain behaviors that people with allergies should avoid, whether it's food allergies, pet, or the hay fever allergies?
No, I mean, we really don't want to restrict the activities of our allergy sufferers. We want to be able to provide them with tools to live a completely normal and productive life.
What are some of the more uncommon allergies that you've seen in your career?
Oh, the uncommon ones sometimes can be the most dramatic ones. I mean, there are people who are allergic to latex, that they have reactions to balloons or condoms. There's a reaction to psyllium seeds that are found in laxatives. I mean, so it's just about anything that has a protein can be an allergen.
And I wanted to ask you briefly, we are running out of time, about occupational allergies, things that are on the job that people can be allergic to?
Yeah, absolutely important issue, particularly with causing asthma. And there are a number of things that workers are exposed to in terms of small particles that are found in the plastics industry and in the painting industry that can cause allergic-type reactions that can give you very severe asthma or even allergic eye and nose problems as well.
How does a person set an appointment with an allergist at OHSU?
All they need to do is to call the main operator and ask for the allergy department, and we can get them an appointment.
Easy enough. That phone number is 503-494-8311, and that number is also on our website, ohsueffect.org. Dr. Anthony Montanaro, the Chief of Allergy and Immunology at OHSU. Thank you so much for being with us.
Thank you for having me.
And coming up in 5 minutes, we'll learn about the Let's Get Healthy initiative, which could be coming to a school near you. That's next on the OHSU Effect.